buch.
Great. Thank you. So it's great to be here. Thanks to SIDE, thanks to the organisers for asking me to speak. Congratulations on the great meeting. It gets better every year. So Si asked me about, can you give a case about atrial secondary MR? And I went, yeah, I can do that. And then I went off and thought, they're the ones that I think the most about, and I will have treated the least. And what I want to convey to you in this talk, as part of my approach to atrial secondary MR, is that we really need to think quite critically about this patient group. What are our aims? What are the expectations of the TEER procedure, as well as how am I to approach it technically? So we've seen, and it's been a relatively recent emergence, probably over the past 7 to 10 years, where we've recognised and distinguished secondary MR and broken it down into ventricular secondary MR, and now we're seeing this group emerging and being recognised in our patient population of atrial secondary MR. And of course we're seeing more and more of this as we see greater prevalence in the patient population of atrial fibrillation, of HFpEF, which are closely associated. And whilst I'm going to talk about how we distinguish between the two, it's important to highlight that there is still a lot of discussion and controversy about how we define atrial secondary MR, let alone how we should treat it. And I want you to bear that in mind. So you all understand ventricular